Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Coughing up mucus phlegm. Coughing up mucus is often a sign of a respiratory infection, allergies, gastroesophageal reflux disease, GERD, or an environmental irritant like smoke or pollution. In some instances, it can be related to a more serious medical condition, including cancer. /r/n/r/n phlegm, the mucus that comes from your respiratory system, also known as sputum, is released when you have a productive cough. The mucus will usually clear on its own as you get over an infection. If you have phlegm and no signs of illness, you should see your healthcare provider for a diagnosis. /r/n/r/n The Good Brigade, Getty Images /r/n/r/n Mucus is a normal part of the respiratory system. It plays an important role in lubricating the airways and defending us against irritants and pathogens. /r/n/r/n However, inflammation from various causes results in an increase in mucus production and a thicker consistency. This results in the familiar symptoms of runny nose, congestion, and coughing up phlegm. /r/n/r/n Respiratory infections, including COVID-19, are a common cause of inflammation resulting in a productive cough. A dry cough is one of the most common coronavirus symptoms, but coughing up phlegm can also be a symptom of COVID-19. /r/n/r/n Bronchitis and pneumonia are two types of infections that typically lead to a productive cough. With bronchitis, the branches of the airways become inflamed and produce thicker mucus. In pneumonia, the lung tissue is infected. /r/n/r/n Respiratory infections can be due to viruses or bacteria. The cough is typically accompanied by other symptoms, like fever, chills, sore throat, muscle aches, fatigue, and a general ill feeling. Talk to your healthcare provider if you experience these symptoms with a cough. /r/n/r/n While infection is a common cause, there are several non-infectious causes of phlegm production, including /r/n/r/n Some environmental and lifestyle factors can also increase phlegm, such as /r/n/r/n It's important to keep your airways clear, and coughing up mucus is one way the body responds to respiratory congestion. Coughing up mucus helps you clear infections and get rid of irritants and allergens from your body. With certain diseases like cystic fibrosis, coughing up mucus is necessary and treatments promoted. /r/n/r/n An occasional cough with an illness is a healthy way to eliminate mucus. However, the American Lung Association notes if you are coughing up mucus for more than a few weeks, it should be assessed by your healthcare provider. /r/n/r/n Mucus production occurs with certain types of lung cancer. It is a main symptom of invasive mucinous adenocarcinoma, IMA, a less common subtype of lung cancer. /r/n/r/n Coughing up mucus, sometimes tinged with blood, can be a sign of other types of lung cancer, but most people also have related symptoms, such as /r/n/r/n A productive cough can also be a sign of other cancers, such as thymus cancer affecting a gland in your chest. Thymus tumors are often seen in people diagnosed with myasthenia gravis and other autoimmune disorders. /r/n/r/n Coughing also is a symptom of pleural mesothelioma, a cancer of the chest cavity lining often associated with asbestos exposure. /r/n/r/n While diagnosing the cause of a productive cough does not rely on phlegm color, it can suggest certain causes. Normally, mucus is clear, but phlegm can come in a range of colors that may point to the underlying cause. /r/n/r/n Treating a productive cough depends on the underlying cause. Medications and supportive care at home can help treat a productive cough. /r/n/r/n Medications. Treating the underlying cause of a productive cough may include OTC or prescription medications, such as /r/n/r/n productive cough may not need antibiotics, since most infectious causes of cough are due to viruses, but antibiotics can treat a bacterial infection. Antibiotics should be used sparingly because they can have significant side effects and overuse contributes to antibiotic resistance. /r/n/r/n Home Remedies Supportive treatment for productive cough includes the following measures to encourage getting rid of phlegm and underlying irritants. /r/n/r/n If your cough doesn't improve after 10 to 14 days, you should discuss your symptoms with your healthcare provider. Other concerning symptoms should be reported to your healthcare provider for further investigation, such as /r/n/r/n Phlegm is a thick mucus arising in the lower airways in response to lung inflammation or injury. Infection is a common cause, but other conditions like allergies, lung disease, and GERD can cause a productive cough. /r/n/r/n Treatment depends on the underlying cause and includes supportive care and medications. Your healthcare provider can help determine the underlying cause and recommend a treatment plan if you are coughing up mucus. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.